The Majority Leader.
7 years ago, the Democrats forced an unfair health care system on our country that they called the Affordable Care Act. It turned out to be anything but that. They told Americans it would lower their premiums, but Obamacare has increased premiums by an average of 105% in the vast majority of states on the federal exchange since 2013. Unless we act, we can expect similar trends for years to come. They told Americans it would expand choice in the health care marketplace, but Obamacare has left Americans in 70% of U.S. counties with little or no options for insurance this year. Unless we act, we can expect things to get worse. They told Americans it would allow them to keep their doctors, their plans, and their ability to make the smartest health care decisions for their families. But instead, Obamacare forced millions off the plans they liked and forced millions into plans they either didn't want or couldn't afford. So unless we act, more Americans will be left trapped, forced by Obamacare to buy insurance, but left without the means to actually do so. This, Madam President, is the Obamacare status quo as millions of Americans have come to know it. It's unacceptable. It's unsustainable. The American people need better care, which is exactly what we're working to bring them. Through dozens of meetings and through conversations with every member of our conference, we've had the opportunity to discuss many different ideas and approaches for bringing relief from Obamacare. Ultimately, we found that there were a number of areas where we all agreed when it comes to what the critical issues we need to address are and how we can do that. Those solutions are what make up the draft legislation that was released last week and that we'll continue to work to consider now. Better care will preserve access to care for patients with pre-existing conditions, strengthen Medicaid, and allow children to remain on their parents' insurance through the age of 26. Better care will lower costs from where they are under Obamacare by, among other things, eliminating taxes on the middle class, by giving Americans more power to control and reduce their medical costs and out-of-pocket expenses, and by giving states significant new tools to drive down premiums. Better care will free Americans from onerous mandates under Obamacare by repealing the employer mandate that reduces hours and take-home pay for too many workers, and by repealing the individual mandate that forces Americans to buy unaffordable Obamacare insurance, freeing them to make the best health care decisions for their families on what types of plans they want and can afford. Better care will help stabilize insurance markets that are collapsing under Obamacare by first implementing stabilization policies, then carefully transitioning away from Obamacare completely so more families aren't harmed by its collapsing markets. And as one major insurer observed just today, this bill, quote, will markedly improve the stability of the individual market and moderate premium increases. That's from a major insurer, Madam President, today. We should keep working so that we can move forward with robust floor debate and an open amendment process here on the Senate floor. I'd encourage all 100 senators to participate because the American people need better care right now, and this legislation includes the necessary tools to provide it.